We're good? Well, good morning, and thank you so much for joining us this morning to provide an update on our government's work to support Albertans suffering from mental health and addiction issues. I'm very pleased to be joined by my Minister of Mental Health and Addiction, Dan Williams, who has been working tirelessly on this file. We are also joined by key people in Alberta's mental health and addiction space, Kerry Bales of AHS, Kym Kaufmann, Dr. Nathaniel and Dr. Nick Mitchell. As many Albertans know far too well, the impacts of mental health and addiction can be devastating, even deadly. Too many Albertans are familiar with the pain that comes with these issues, including friends and family who too often feel helpless as their loved ones struggle. We on a promise to improve healthcare delivery in Alberta, especially when it comes to mental health and addiction. We have already taken a number of steps to improve access to treatment and recovery supports that give people a new lease on life. We funded 10,000 additional treatment spaces so more Albertans can access detox treatment and recovery supports each year. We've made medication-based treatment for opioid addiction available on demand through the virtual opioid dependency program with no fees and no wait list. And I'd like to congratulate Dr. Nathaniel, who's with us today, for creating the program and helping it to grow to over 8,000 users. We finished building two of our, what will be 11 new recovery communities. Recovery communities in both Red Deer and Lethbridge have welcome clients and are providing life-saving care every day. The remaining 9 are in various stages of planning and construction, with 5 of these projects being built in direct partnership with First Nations and Indigenous communities across Alberta, which is an historic step forward in reconciliation. And we've created same-day access to affordable and accessible counselling services through Counselling Alberta, which can be reached through 211. Each of these initiatives is only one part of the comprehensive system we are building, and we are already starting to see positive trends. Over time, far fewer Albertans have lost their lives to addiction in our province, and many drugs have their lowest mortality rate on record. Since 2021, deaths from alcohol are down 60%. Deaths from methamphetamine are down 41%, and deaths from cocaine are down 61%. In addition, since 2018, deaths from pharmaceutical opioids are down 70%, and since 2017, deaths from benzodiazepines are down 33%. While opioid addiction continues to be a significant area of focus for our government, it is important to remember that addiction is much more than opioids. The vast majority of people struggling with addiction are not using opioids, and in nearly every metric, we're seeing addiction-related deaths at all-time lows, which is a cause for optimism. With that being said, there's still so much more work that needs to be done to address both mental health and addiction in Alberta. That's why we're taking bold steps to improve the healthcare system. For too long, the planning and delivery of mental health services was fragmented across AHS, and unfortunately, this lack of focus has led to systemic deficiencies in the system. We began making changes to this when we created a standalone ministry for mental health and addiction, elevating it from an associate ministry. And last August, Minister Williams took another step forward in addressing deficiencies in the system when he directed AHS to consolidate the operations of all of its mental health and addiction services into one provincial structure. The consolidation of operations was complete in November of 2023 with no disruption to service delivery. And shortly after, we began the work of refocusing AHS as a whole and creating 4 specialized areas of focus: primary care, acute care, continuing care, and mental health and addiction. To effectively plan and deliver mental health and addiction services in Alberta, we need to have an organization dedicated specifically to that. That's why I'm excited to announce today the creation of the new mental health and addiction organization called Recovery Alberta. Recovery Alberta will be the new provincial health agency responsible for delivering mental health and addiction services currently delivered by AHS, and will be established through legislation introduced this spring. If passed, we expect operations to move from AHS to Recovery Alberta by July 1st, with all mental health and addiction services currently delivered by AHS transitioned to the new agency. For Albertans struggling with mental health and addiction, or have loved ones who are struggling, the creation of Recovery Alberta means you will have access to a better and more effective healthcare system that will lead to better healthcare for Albertans. For those currently accessing care through AHS, addiction and mental health, you will continue to access services in the same way that you do now. For frontline staff working with AHS, addiction and mental health, I want you to know that we are working closely with the transition team at AHS to ensure the transition toward Recovery Alberta is orderly and seamless. And throughout, Minister Williams and members of his transition team will continuously engage with Albertans and those working in the healthcare system to ensure the transition toward Recovery Alberta is as smooth as possible. Now, in addition to establishing Recovery Alberta, we must also ensure that we are building a system of care that relies on the best available evidence and data from here in Alberta and around the world. That's why I'm also pleased to announce that we'll be establishing the Canadian Centre of Recovery Excellence, or CORE. CORE will be a Crown corporation under the purview of the Ministry of Mental Health and Addiction through legislation, also to be introduced this spring. CORE's mandate will be to conduct research and program evaluations, provide advice to government on international best practices, develop standards of practice in mental health and addiction, and provide leadership in the field here in Alberta and across Canada. Alberta already leads the country in supporting recovery from mental health and addiction challenges, and the Canadian Centre of Recovery Excellence will further support this work. Today's announcement of these two organizations marks an important step forward in transforming our healthcare system, but it in no way marks the end of our work to provide the very best healthcare to Albertans. Our commitment to transforming the healthcare system is an ongoing promise to all Albertans and their families. We will do what it takes to deliver the best care possible. I'd now like to invite Minister Dan Williams to share a few more details.
Well, good morning, everyone, and happy Easter. And thank you, Premier, for that. As you heard, we're incredibly excited to be moving forward with the next steps in refocusing Alberta's healthcare system. Tragically, our society is facing an addiction crisis that is devastating our families and our communities. On top of that, mental health challenges are impacting people of all ages, putting more people in difficult situations that lead down a path of pain and misery. Our government wants to ensure everyone is getting the right care and support where and when they need it. For the past 5 years, we've been working to build a system focused on recovering. Under the banner of Alberta Recovery Model, we have been proud to make the investments needed to change the lives of Albertans. These investments are making a difference and setting an example for others to follow in what truly will have a recovery-oriented system of care. Today, our government is proud to be announcing future steps in building the Alberta Recovery Model and making more improvements to our mental health and addiction system. The establishment of Recovery Alberta, the establishment of Recovery Alberta follows the announcement last year to create our organization to deliver health care for all Albertans. Responsible for mental health and addiction, Recovery Alberta will be the largest provider of services across the province, operating with staff and $1.13 billion in funding currently supporting the mental health and addiction services within AHS. 5 years ago, there was no minister responsible for mental health and addiction. Now, with a full ministry, the establishment of Recovery Alberta is an important step towards access to consistent care across our province. Last year, my ministry took steps to consolidate all mental health and addiction services within AHS to provide direct accountability within AHS for the provision of these services. This consolidation was done with no disruption to services and will ensure that we have a smooth transition into Recovery Alberta because of that work done. Leading Recovery Alberta as CEO will be Kerry Bales, who currently serves as Chief Program Officer for Addiction and Mental Health and Correction Health Services within AHS. He will be supported by Dr. Nick Mitchell, the Provincial Medical Director of Health for Recovery Alberta. Frontline staff currently working in AHS, addiction and mental health, will transition to Recovery Alberta with no changes to their terms or conditions of employment. Additionally, there will be no changes for contracts or grants for service providers currently under agreement with AHS upon the establishment of Recovery Alberta. For our next steps, our government will be putting forward legislation this spring that, if passed, will establish the structure of Recovery Alberta by June 3rd. We anticipate Recovery Alberta will be operational by July 1st of this year, which is when staff will be transitioning into the new organization. This is how we are improving mental health and addiction services and ensuring consistent access across the province. To be clear, for those receiving care, services will remain available at the same location throughout the transition. The purpose of this transition is that we can grow services across the province. As we have said from the beginning, we are working with Albertans and frontline staff as changes are made to our healthcare system. In the coming weeks, I will be hosting 4 engagement sessions with AHS staff and service providers so our team can answer the questions regarding the transition to Recovery Alberta. Now I want to talk about the Canadian Centre of Recovery Excellence, or CORE, which is an organization we are establishing on a research-based evidence policies to support Alberta and other jurisdictions in building recovery-oriented systems of care. Their work will be critical in further developing the Alberta recovery model and making sure improvements to our mental health and addiction delivery services continue. Despite all provinces across Canada facing an addiction crisis, there's no clear centre of recovery. Despite all provinces across Canada facing this addiction crisis, there is no clear centre of recovery excellence that is advising on what works and what does not when it comes to treating mental health and addiction. It is important to have jurisdictions working together, rowing in the same direction when it comes to creating healthy societies. As an initial investment, we are providing $5 million this year to stand up CORE, with legislation being introduced in the coming weeks. As the former Deputy Minister of Manitoba's Ministry of Mental Health and Community Wellness, Kym Kaufmann will lead CORE as a CEO and will be supported by Dr. Nathaniel as Chief Scientific Officer. The development of these organizations is an important step we are taking to care for and support Albertans in the pursuit of recovery. We will not sit back as our brothers and sisters and fellow Canadians suffer in mental health or in addiction going forward. With the right care and supports, recovery is possible, and we look forward to delivering that through Recovery Alberta with support from CORE. Thank you, and I'd like now to introduce Kerry Bales, the Chief Program Officer of Addiction and Mental Health and Correctional Service within AHS, and our future CEO of Recovery Alberta. Kerry.
Thank you, Minister, and thank you, Premier, for your ongoing efforts to prioritize and place a greater focus on mental health and addiction services across the province of Alberta. I'm honored to join you this morning as we chart a new path together to improve the health and well-being of Albertans. As you may know, I've been with Alberta Health Services for many years, some might say too many years, starting as a healthcare aide in the Dr. Richard Parsons Auxiliary Hospital in Red Deer in 1996. In my experience, few areas of healthcare are as complex as mental health and addiction. Our province faces numerous challenges, from the opioid crisis to the growing number of young Albertans seeking help for anxiety and depression. These issues have only intensified in recent years in Alberta and beyond. The bottom line is now, more than ever, mental health and addiction needs our focus, our energy, and our hope. The concept of recovery is often described as one of hope, seeking outcomes that change the lives of people in an enduring and long-term way. It doesn't mean we don't care about those in crisis, because we do, and we continue to provide care for those individuals. But we want to give those who are struggling access to clear pathways that allow them to take greater control over their lives and their futures. The establishment of Recovery Alberta provides an opportunity to achieve that goal. Recovery Alberta is built on the foundation of mental health and addiction services that staff and physicians deliver today. We've been in the mental health and addiction concerns sooner. Alberta Health Services staff who operate in addiction and mental health and correctional health facilities number more than 10,000, and they can be found making a difference in every corner of this province. You'll see them in outpatient, virtual, acute care, detoxification, standalone psychiatric, and provincial correctional settings. contributing in every way, from providing community outreach to bed-based mental health and addiction treatment. These staff are deeply committed to the patients and clients that we serve. They support all Albertans in their current mental health and addiction realities and help them to navigate whatever the next steps might be. I'd like to take a moment to thank our staff and physicians for their continued commitment and compassion. Your work remains essential to the people that we serve. Please know we're going to do everything we can to ensure the transition occurs with as little disruption to you as possible. The transfer from AHS to Recovery Alberta will not result in any changes to terms and conditions of employment. That includes pay, benefits, pension, and union affiliation. For patients, clients, and families seeking support and resources, we are here for you. The same way we've always been, all services remain open and available. Neither the announcement today nor the establishment of Recovery Alberta will disrupt the care and services that you receive. Today, we are presented with a unique opportunity to provide a genuinely proactive, collaborative, and coordinated approach, and we intend to make the most of it. For our patients, clients, and their families, our staff and clinicians, and all of our communities, I look forward to our future together, and thank you very much. And I'll introduce Kym Kaufmann.
Thank you, Kerry. Hello and welcome, everyone. My name is Kym Kaufmann. I'm extremely pleased to be the first incoming Chief Executive Officer of CORE, the Canadian Centre of Recovery Excellence. This new organization represents an exciting step in addiction and mental health, not only for Alberta, but also worldwide. For the first time in Canada, there will be a site of expertise and insight on recovery. This is a huge step towards advancing mental health and addiction programs and services, and I'm so proud to be part of it. CORE's objectives are to lead research and evaluation, to identify the most effective means to help individuals with addiction and mental health, to ensure credible, objective evidence is available to decision makers, and to provide provincial, national, and international leadership on recovery-oriented systems of care. Simply put, CORE will evaluate what works and what does not work when it comes to helping individuals with addiction makers, and to provide provincial, national, and international leadership on recovery-oriented systems of care. Simply put, CORE will evaluate what works and what does not work when it comes to helping individuals with addiction and mental health concerns. It will help the government advance the Alberta recovery model and will offer guidance to other jurisdictions learning from this approach. CORE will collaborate and develop partnerships with experts from across the globe. Evidence and best practices will be shared provincially, nationally, and internationally, helping advance the dialogue on the importance of recovery. I've worked in the mental health and addictions field for many years, and I believe the Canadian Centre of Recovery Excellence is going to be a game changer. We know it's no longer enough to simply introduce well-intentioned programs and services, but instead we need to rigorously evaluate what works and what does not work so we can double down on the successes rather than the failures. CORE will do this and position Alberta to be a global leader in recovery-oriented care, and it will help save lives by ensuring the most effective programs and services are available to those in need. I, along with CORE's future Chief Scientific Officer and Addictions Physician, Dr. Nathaniel, look forward to getting started. Thank you.
Thank you. We'll now make our way into the media Q&A. I just want to note first for those online, apologies for the issues with the video for the live stream, and just noting that the full video will be available on the Your Alberta YouTube page after we finish up today. With that, we'll start off with one question and one follow-up. We'll start off with questions here in the room before making our way to the phones. And please just state your name and outlet before asking your question. And we'll start off with our first at the mic.
Hi, Sean Polzer, Western Standard. Would you characterize this as a response to, say, some of the other programs in some of the other provinces where you have the safe supply and the proliferation of these safe supply medications that are crossing the border?
Well, we've certainly taken a different approach in Alberta, and you can see the difference between British Columbia and Alberta. And we want to make sure that we've got good information, testing out, looking at what the outcomes are so that we're able to do more of what works and do less of what doesn't work. So we have invested in a recovery-oriented model. We've got our first recovery community that opened in May of last year. And then the Lethbridge one opened at the end of the year. So we're just now beginning to get some results data. And since we're at the really early stage of being able to accelerate the number of people going into the program, I think it's time for us to look at the data. Our virtual opioid dependency program, as well as mentioned with Dr. Day having set it up, it's got 8,000 people on it. That also allows for us to see the extent to which that's been successful. So I think we've got a lot of data now, and we just want to make sure that we're making the best decisions to continue to support recovery. And then I don't know if Dr. Day wants to respond at all on the, wants to respond at all on the comparison between the safe supply model versus what we're doing here, and the extent to which that will show up in the research. I think I'll leave it to the expert to maybe address that.
Sure.
Thanks for the question. I think that, from the perspective of Alberta and our Alberta system, we have been busily occupied with doing our utmost to develop a system of care that responds to the needs of Albertans. And our development of this system hasn't been directed at, doing the opposite of somebody else or responding to someone else's, opinions or beliefs about what would be most effective. But it's really been looking at what evidence we can find and try to deliver absolutely the best possible care that we can for Albertans, full stop. That being said, there are opportunities for us to learn about what other jurisdictions are doing, both things that are effective and things that are not effective, because ultimately Albertans deserve to receive the best possible care that they can. Every dollar that's invested by the taxpayer in providing care in the addiction and mental health space in Alberta deserves to be spent in the best possible way for the people who deserve those services. So my perspective is that rather than looking specifically at what one jurisdiction is doing versus another, it really should be focused on how do we provide the best possible care for the people we serve. In doing that, though, Alberta has become a leader in different spaces. So, for example, providing addiction care in police cells is something that happens in Alberta, and we're not aware that that happens in anywhere else in the world. And there are other jurisdictions that are looking to us to say, what are you learning from that? Well, we need to dive deeply into the data and find out what are the outcomes, what are the benefits, so that we can help other jurisdictions also do excellent care for their people. In a similar way, the virtual opioid dependency program is an international leader. We receive calls from all around the world and requests for information across Canada, North America, Europe, Asia, wanting to know how we went about building a system where a person can actually receive the care that they need the same day that they ask for it. And so there are things that we certainly can do better. There are things that we need to learn, and there is information and evidence that we can also export, because it isn't just Albertans who are suffering with addiction and mental health challenges.
Okay. The reason I asked is I think I heard on the radio this morning the overdose numbers came out. I believe, what was it, yesterday, and what was it, about 1,700 in 2023. So when are we going to start to see these numbers come down? And just kind of as a sideline to what you were saying about the care and prison cells and that, is there still any thought of mandatory rehab for some of these people against their will, presumably?
So a couple things. That's part of the reason why I wanted to look at all of the stats that we've seen since 2021. Deaths from alcohol down 60%, deaths from methamphetamine down 41%, deaths from cocaine down 61%, deaths from pharmaceutical opioids down 70%, deaths from benzodiazepines down 33%. To put that into the context that, yeah, we still have a problem with illicit opioid. And that's part of the reason why we've taken the approach we have of connecting people to the virtual opioid dependency program, which has been very successful, even through our navigation center as well. We found that by making that service available, people have been asking for that too. So it's going to be, we have to build our recovery system out. As I mentioned, we'll have 11 of these communities, which is over 750 new beds when you think about the number of people that we're going to be able to help through it. And we are still at the early stage of rolling that out. I believe we've got 4 in the corrections facilities. We have 2. So we've got 2 of these programs in the corrections facilities, another 2 coming online. So this is the perfect time for us to launch into the data analysis, because we are at the early stage of being able to see the program and then also be able to see what those outcomes will be. I don't know if Dr. Day wants to give a prediction about what we're likely to see on illicit fentanyl. I mean, if there was a solution, I think it's going to be found here. And I don't know that anybody has really found the solution for that, other than making all of the different avenues to get into treatment a lot easier to do. Did you want to add anything, Dr. Day? Do you have more to add on that?
The one comment I would add with respect to illicit fentanyl, carfentanil, and the illicit overdoses is that we are seeing, while the numbers are still quite high and they're higher than what any of us want to see, the fact of the matter is that we are seeing some up and down. And there are other jurisdictions that are seeing ups and ups and ups only. And so we're hopeful that, as our program development continues and as we continue to learn from what's working and what isn't working, that we are hopeful that in time we will see more downs and less ups. But it's obviously an extremely challenging problem that's facing all jurisdictions in North America.
Thank you very much.
Thanks, Sean.
Edith Boisvert, Radio-Canada. We've been told that there were no official consultation between AHS and Alberta Health and with frontline workers in the mental health service. How do you think it will affect this structure?
Well, look, we've been pretty clear from the very beginning that we were going to be refocusing healthcare. We spent the first 6 months sort of assessing where the nature of the problem was. And then when we announced the refocusing back in November, we made it very clear that mental health and addictions was going to have a special focus by elevating the ministry from just an associate ministry under health to a separate standalone ministry. And the work that Dan has been doing that began last August all the way through to November, I would say that we've been very open about the direction that we're taking. And the fact that they've been able to do all this work seamlessly, I think, should give some confidence that when we have the new structure in place formally in July, that we'll be able to maintain that structure. That was part of the reason we began the notification process when we did, is that we know that when you get into bargaining, it kind of locks in the structure that you have. It's why we began very vocally announcing that we were making these changes in November so that everybody knew the direction we were going. So
there were no official meeting with frontline workers in the mental health department?
Well, I can talk to maybe Kerry can answer that, since he's the one who's going to be overseeing it.
Thank you, Premier. Yeah, prior to the actual announcements of the refocusing, there wasn't any direct engagement from a staffing perspective. But since that time, there's been an iterative process, and again, not necessarily within the context of the refocusing that was announced later this fall. But since we've been doing the consolidation work that began in the summer, and even prior to that, this has been an iterative piece of work where we've been engaging with both our leadership and our staff and clinicians. I think, as always, we generally feel, though, is we're never able to engage enough. And that's what today is going to mark. And so there's been a lot of work done leading into the consolidation for this past fall. And then as we've been planning for the actual transition to Recovery Alberta for July, this will provide us with an opportunity to do more of that direct engagement as we start to get into more of the details around some of the transition planning. And as the minister had suggested as well, there's some town halls that are going to be coming. We're going to be doing a lot more engagement with town halls within AHS as well. So that engagement is going to continue to grow.
So you don't need their input?
Well, let me just say, look, we're moving in this direction, and we will get input on implementation. Like it wasn't a question of whether we were doing this or not. We made it clear we were doing it, and now we're announcing what it looks like. We're putting the pieces in place, and now on the implementation, we'll be doing a lot of input, because that's where we're going to get the best ideas about how to make some of the changes. I mean, the whole purpose of moving this over was to move it over with the least disruption possible, with the continuity of staff, with the continuity of service delivery. Now becomes the work of how do we improve it? And absolutely, we want to have our frontline engaging in that. So now that we've started this new structure, that work begins.
So there
Thank
will
you,
be
and we're going to have to go on to the next
meeting?
question.
Yeah, there'll be town halls. I mean, when you look at the kind of work that Adriana has done, I think she's had, well over 50 town halls across the province, engaging thousands of frontline workers. And so Dan is going to have a very intensive process now that we've announced the new structure. May I add something? Sure, please come.
So to be clear, all along, I, on a daily basis, have been engaging with frontline staff in conversations, and their input has informed the process from an executive level to the individual delivering the care, whether that be mental health and addiction. This timeline that we have, the 3 months now before we see the transition on July 1st, affords us the ability to make sure we get those finer details right. And if you're asking about engagement in a formal sense with the unions, we're going to be having meetings with them today, where we're going to have a lengthy conversation. And the process has been a collaborative one from the very start with AHS, and I know it will be as well. I want it to be with the unions responsible for their employees. We all want to see this end up right. Mm-hmm. The frontline AHS staff that work in mental health and addiction don't do it for the glory. They have a deep, deep passion for the care and well-being of Albertans. I recognize that, and that's why I see it as a partnership with them, and that will be our mantra going forward.
Thank you, Minister.
Alex Dollywell, Rebel News. Premier, last month, RCMP detachments in BC confirmed that hard drugs obtained legally in the province are being sold by users to organized crime who are distributing them across the country. Some are selling less potent narcotics to criminal enterprise, such as hydromorphone, to purchase fentanyl. Given that teenagers, for example, are accessing fentanyl substitutes on the black market, what addictions advice would you give the BC government and other provinces considering the safe supply approach?
Look, I recognize that BC has the right to develop their own policy, but we also have to make sure that the consequences aren't coming over into our border. That's why we have asked the federal government to put chemical tracers into the pharmaceutical drugs that they are using to supply on a prescription basis. The federal government has declined, which we think is an incorrect decision, because we need to know when there's overdoses, if there's some evidence that came from from British Columbia. So we're going to continue pressing on that. My ministers have also met with their counterparts in British Columbia so that we can talk about how we can get more data on this. Right now, it's a bit of an unknown how much of the drug seizures contain these prescribed high-powered opioids, and we think we need to know that information. Plus, we are going to continue the cross-border work with the RCMP and with our dedicated units to make sure that we stop the flow coming into the province. But at the moment, we don't have enough information to talk about the extent to which it is coming into Alberta. But we do have the seizure, so we have to presume that there is a certain amount. And I don't want anybody to think that there's any such thing as a safe supply of opioids. That is what we were told when OxyContin came onto the market, and it's what led to the massive addiction crisis that we're still struggling with now. These drugs are 5 times as powerful as heroin, and making them available in a prescription format where it has been shown that they're being traded in the market and then showing up to younger and younger people, that has us concerned. I mean, the one piece of evidence that we did see was the BC Medical Examiner's report. There, 5 years ago, there were no underage kids dying of hydromorphone overdose. Now it's about 1/3 of kids in British Columbia are dying from hydromorphone overdose, and that is what they are calling their safe supply drug. So we don't want to misname it. It's a high-powered opioid provided by prescription. We don't do that in Alberta. We have a very focused approach with a pain management doctor and pain management specialist. We try to move people along to replacement therapy. And that's, I guess, what we're going to see, is whether there's a difference in Alberta and BC. But we want to make sure that those policies and those drugs don't come into our market.
And as an aside, Prime Minister Justin Trudeau's government has splurged $42 million on its firearm buyback program without confiscating a single firearm to date. Should the federal government try again to implement the program, would your government consider invoking the Sovereignty Act in a bid to protect the property rights of law-abiding Albertans?
Well, I call that a success, that they haven't been able to seize a single law-abiding firearms owner's gun. So I wish them continued success at being able to achieve zero compliance with their program. And we are not going to do anything to help them. We believe that the issue is the illegal firearms getting into the hands of gangs and organized crime coming across the border. And the federal government should be focused on that, not focusing on taking guns away from sport shooters, duck hunters, and farmers.
Thank you.
Hi. Oh, I'm too short for this mic.
I can hear you.
Tiffany Goodwin, 660 News. One of the big issues, I'm sure we're all aware, with mental health is, you know, the time it takes to get care. So what about this Recovery Alberta makes that better so that people don't have to face that barrier, you know, long wait times to access, you know, counseling or addiction services or, you know, anything of that sort?
Well, I'll have Dan come up and answer as well, but let me get started. There are two ways that you can get immediate counseling service. Call 211, so that is our same, you can call and get connected with a counselor for same-day service. Our virtual opioid dependency program as well, that gives the alternative to the addictive opioids through Suboxone and other types of drugs that act as a replacement. You can get same-day sign up on that as well. But let me get Dan to talk about the access to the detox spaces and the recovery spaces.
Thank you, Premier. So obviously the virtual opioid dependency program is a zero wait time, province-wide, near immediate access to evidence-based treatment for those suffering from an opioid addiction. Anywhere that has a pharmacy in any community, you can get it right away. It's a pioneering program, as we heard from Kerry, and it is world leading, over 8,000 a day. 211 for counseling. We know we need to do more in mental health and addiction. I would say if we look at the trajectory of where we've been as a province, we started off in 2019. Before we came into government, there was no minister of mental health and addiction, and then we had an associate minister, and Premier Smith wisely decided that this is a priority for Albertans and made it a full ministry just over a year ago now. And so we now have $1.55 billion in our budget for mental health and addiction. And I promise you, if you don't want to focus on a policy area, put it in mid-level management in the country's largest employer, and you could find that it's not going to be a center of policy concern. But if you get a minister with a budget line item, the largest that I know of anywhere in Canada, of any province, and say that this policy area is directed to you, we want to see oversight, we want to see transparency, we want to see innovation and improvement, that's where we've seen these increases with access through 211 and Counseling Alberta. That's where we've seen the virtual opioid dependency program grow to this international leader. This is more of what we can expect in Recovery Alberta, is this innovative policy where myself and my team, under the guidance of the Premier's office, get to have successes where we focus on mental health, whether that is a mental wellness question in a family with a youth who feels anxious or depressed, or it's somebody living on our streets in minus 40 weather in the middle of winter suffering from an opioid addiction, speedballing meth and fentanyl together. Every single person deserves an opportunity at recovery. They have dignity as Albertans, as Canadians, and that's why we're able to focus so much on it with this organization.
Do you have any stats on what happened at the Navigation Centre? And who connected where?
Navigation Centre is a good example of collaboration between ministries where mental health and addiction was able to focus as a participant. We had dozens of individuals get access to opioid agonist therapy. I can tell you one individual, a gentleman in his 70s, who was an opioid addict, multiple interactions over the last month with emergency room overdoses and EMS responses because of overdoses. And for context, that means that they stopped breathing and they started to have cerebral hypoxia where oxygen wasn't getting to the brain at 70 years old. And because of the Navigation Centre, this individual who did not know about same-day access, zero-cost, immediate service for that evidence-based medicine is now on that. And months since then is one of the dozens of people that otherwise wouldn't have had it, now has had no overdoses that we know of, no ER responses, and is able to live a fulfilled life on their journey towards recovery.
Great. I'm just going to throw this out there because it's going to come out. Is this a private model, and is this a way to save the government money?
Well, Crown Corporation, by definition, is government-owned, and the Recovery Alberta is under the ministry of Dan Williams, and it's 100% government-funded. And in fact, it was the NDP that was charging people for treatment beds. When we formed government, we took away that, I think it was $1,200 a month. We took away that cost. So in fact, we've made it more accessible.
Hi there, Terry from CTV. I have a question first about the protests that are still going on Highway 1. According to Cochrane RCMP, disruptions are expected to continue today. Is the province at all considering using the Critical Infrastructure Defense Act, and is there any direction being given to the protesters to move where they don't constrict some of these economic corridors?
Well, look, let me give that direction. I don't support it when Extinction Rebellion glues themselves to the street and stops traffic, and I don't support anyone stopping traffic as well. You can protest, do it at the side of the road. Don't interfere with the movement of goods. Don't interfere with the movement of your neighbors. It's the reason why we have the Critical Infrastructure Act, and I would just ask people to be compliant with the law.
And do you have any comment on the video that's circulating from 2021 where you're talking about the carbon tax rebates leaving you better off financially, I believe with the Fraser Institute, and why, you are a vocal opponent of the carbon tax, kind of where that message shift and why different now?
Well, I think if I can recall the context, although I'm a bit fuzzy on it, I think I may have been comparing it with the NDP carbon tax and how it was administered versus the way Justin Trudeau administered the carbon tax. So you may recall the NDP, when they brought in their carbon tax, they collected it centrally and only gave a third back to Albertans and only gave it to the lowest income Albertans. And then they took the remaining 2/3 into government revenue. And so by comparison, having the federal government take the carbon tax in and return a portion to some Albertans is preferable to the model that the NDP had, but people are still not better off. 2021, you have to recall, we were still in lockdown. We're not in lockdown anymore. So I would imagine that most people would have a different experience today, and the taxes continue to go up year after year, and so the amount that people are paying is still going up. So when I look at the Parliamentary Budget Officer, I mean, it's their own data that shows that the very low-income individuals may be getting back more than they pay in, but as you go up the income scale, you're paying more and more and more, $911 on average this year, and up to, I believe, $2,300 by 2030. In addition, it's immoral to be putting the carbon tax on home heating. We especially at the level that it's at now. I mean, it's one thing for it to be irritating and harmful because 35 cents of every $1.50 fill is what they're charging at the federal level. But on home heating, the federal government is now going to be charging $4.09 on the carbon tax, and the gas only costs $1.72. So I don't know on what planet anyone thinks that charging 2.5 times on a carbon tax with the base price of fuel is, especially in a cold climate like ours, makes any sense. But there's no metric, there's no rebate that is going to compensate for that. They should completely take the tax off, in my opinion. But barring that, they should at least stop increasing it. And I'll just quote Andrew Furey because like he is a liberal premier from Newfoundland and Labrador, and he wrote a letter out calling for an emergency meeting, which we also support, saying that there isn't a solution to the guy who's loading up his fishing gear into his truck and taking it down to the dock to do a day's work. He can't just get an electric car. He can't just get a hydrogen car. The options aren't available, and they won't be available for some time until we build out the infrastructure. And so it's just punishing people, and they're frustrated by it because there's no way for them to practically be able to avoid the cost. That's the reason why it should come off now. There are other ways for us to be able to achieve the outcomes that the federal government wants to achieve. The carbon tax has been tried. It's failed. It's punitive. People don't like it, especially in the middle of an affordability crisis. It's got to go.
Thank you. We're going to have to go over to the phones here to get through some questions.
Question here.
And then we'll
Carolyn
just come back.
Koval. I just want to follow up on that.
Sure.
One, please. What would you say now to the 343 economists that are now saying that the carbon tax is the most effective and least costly way to reduce emissions?
I think they should read economist Ross McKittrick's column that appeared in the last couple of days, where in the absence of any other policy, a carbon tax in theory, might be the most efficient, but that's not what we have. We have clean fuel standards. We have a proposed emissions cap. We have a proposed fertilizer cap. We have a proposed methane cap. We have a proposed plan to phase out vehicles. We have a proposed plan to be net zero on our power grid. Like when you start layering all those things, we've got industrial pricing schemes. We've got cap and trade in Quebec. So in the theoretical model, where the only choice you have is one, then I suppose that might make sense. But in the real world, where we are layering one type of policy on top of another, it's not effective, especially since The options aren't available. They don't exist. There isn't the ability to turn over in Alberta, where almost 100% of our businesses and 100% of our homeowners are on natural gas. There isn't the ability to overnight switch to something else. Doesn't matter how high you put the tax up. It's just going to be an extra tax. There isn't the ability to overnight have everybody purchase an electric vehicle and upgrade our electrical grid so 100% of people can be on electric vehicle. It can't happen. So we're at a point now where people understand that we want to move towards emissions reduction. But then let's start working on the things that we need to do to build out the options for consumers. In the meantime, it's just punishment. People see it. They know they can't avoid it. They know that it's an extra tax. They know it's hurting them, and they don't want it.
So what would you say to the economists, though? I mean, they have these studies. They went through all the list of where it does work and why it works. Are they dismissing their knowledge?
I think the economists should get out of their ivory towers and come into the real world. Is what they should do. They should tell me how charging some mom who wants to take her child to a soccer game, how that's reducing CO2 emissions. They should tell the fisherman how him having to pay an extra carbon tax to take his gear down to the dock, how is that reducing carbon emissions? That's the problem, is that it's not working because the infrastructure isn't there yet. The options aren't there yet. What the federal government should do is work with us on building the infrastructure. Help us build out the hydrogen economy. We just announced our first hydrogen fueling station. We have 100 hydrogen vehicles in our market. We have a single dual fuel vehicle that has made the trip between Calgary and Edmonton once. That's the nature of where we find ourselves at this precise moment with infrastructure. And that's what we need to build out. We need to make sure that the federal government is working with us on the things that are actually going to work, rather than continuing to punish our consumers.
Thank you. We'll head over to the phones now. Operator, can you put through our first caller, please?
Lisa Johnson, Canadian Press.
Hi, good morning. I just wanted to follow up on a previous question there, Premier. You said in regards to the Critical Infrastructure Defense Act that you would just ask people to be compliant with the law. Can you just tell us yes or no whether you're willing to use that act to quell these protests if they continue to affect highway traffic?
As you know, police make their own decisions on arresting decisions. That's not a decision for a premier to make. I'm just asking people to accept that we have a Critical Infrastructure Act in place, and I don't endorse it when left-wing activists want to block bridges and roads, and I don't endorse it when people who are opposing carbon taxes also want to block bridges and roads. There's a way to be able to do peaceful protests and continue to allow for the flow of goods and people.
Thanks for that. And just on the topic of this announcement today, I'm wondering if Kym Kaufmann might be able to comment on this. Will CORE, I understand it's going to be a Crown corporation, will CORE proactively disclose its data and research publicly on recovery efforts, including relapse rates, for example, thinking something akin to the Substance Use and Surveillance Data Dashboard, or is this something that we're going to have to FOIP?
Yeah, I'm not sure that CORE will be the one to disclose this, because a lot of this information is already available through the ministry. But it's something that we will plan out over the next many months and work in partnership with the Department of Mental Health and Addictions to determine who's the most appropriate party to release that information.
Thank you, Lisa.
And I would just say, I mean, we want the information to get out. I mean, this is the whole purpose of having a research entity that has the ability to collect information that can be available to any number of researchers, not only in our province, but in our country and around the world. So we'll make sure that Dan has some good policies and protocols around that, but we want the information to get out.
Thank you, Lisa. We have time for one or two more questions. Operator, could you put through the next caller, please?
Alana Smith, Globe and Mail.
Oh, hi there. Thanks for taking my question. This one's for the Premier. Earlier you said that, there's been positive trends over time. You said that there are, quote, far fewer Albertans who have lost their lives to addiction. Of course, the provincial data shows that we actually just recorded our deadliest year, 2023, on record for addictions overdoses, for drug poisoning overdoses, which includes things like alcohol. I was also looking a bit at your stats. You said alcohol deaths are down 60%, but that same dashboard says that the percentage of deaths involving alcohol in 2021 was 23%, in 2023 is 17%. So yes, there's a decline there, but not so much as 60%. So if you have different data for me, I would love to see it, just because I'm a bit confused as where you got those numbers. Sure. But generally speaking, let's say we are seeing a lower percentage of deaths involving certain substances, yet at the same time we're still seeing an all-time high for drug deaths. I'm just wondering if you think this suggests that there's been progress in Alberta.
Well, I would say that we've got an integrated drug market with BC. And so that's something we have to keep in mind, that we're experiencing the same issues that they have in BC. Now, BC has taken a different approach, and they are making these powerful opioids more available. And we're taking a different approach, and we're going towards recovery. And I think we're beginning to see that British Columbia's deaths are, on a per capita basis, higher than ours. So, of course, we haven't solved the problem. But if Safe Supply worked, that wouldn't be the case, right? If Safe Supply worked, then you would expect for them to have lower rates than we do. So that's what we need to research and study is, and we've got an opportunity to look at the policies next door and see what's working, and look at our policies here and see what's working. We're at the very early stages. I mean, as Dan mentioned, we're going to ultimately have 4 corrections facilities that have on-site recovery. Right now it's only 2. And then last year we opened a single recovery community. It has 75 beds. It takes a little while to not only get patients and on board, but also to have them go through the program. And then the second one was opened in the fall. So I would say it's a bit early for us to be able to see a huge amount of impact. But I'm encouraged. I mean, the fact that we have individual stories of people taking us up on our offer to go into the virtual opioid dependency program. The fact that I think we've got 8,000 people on that versus in British Columbia, I believe they've got 6,000 people on prescribed drugs for Safe Supply. So we're taking 2 very different approaches. And I think we'll see with the passage of time which ones have the likelihood of having a better outcomes. But recovery should be the desired outcome. That's what we should be striving for. That's why we've named it Recovery Alberta, is that anybody who is in the despair of a drug or alcohol addiction should know that recovery is not only possible, it's actually the more likely outcome. We have a recovery community that is tens of thousands strong. We've got a recovery conference starting tomorrow that has sold out and is on a waiting list. We've got 2,000 people from around the world who are working in this area and excited about the approach we're taking. So have we seen immediate success? Not yet, but I'm very confident that we're on the right track, and we're working on programs that'll save people's lives every day. Yeah.
I'll just add as well, if you look at these contrasting models, it's pretty clear that the model in Lower Mainland BC has been ongoing for 2 decades now. They have had their harm reduction model, which has now reached what I think is its zenith with its most radical policy in the world of Safe Supply. And it doesn't matter where those drugs come from, whether it be a drug dealer or Justin Trudeau funding it. The truth is that massively increases the supply of drugs in that integrated drug market between BC and Alberta. And so we have been doing the recovery model at the start of the policy for a little under 4 or 5 years with a pandemic in between, and now we're only now establishing Recovery Alberta and CORE. We are at the very genesis of what is the only way that Alberta sees as a path of getting people out of addiction. And if we want to see not just a decrease in overdoses and deaths surrounding alcohol, surrounding pharmaceutical opioids, surrounding methamphetamine, surrounding benzos, we want to see those illicit opioids also drop, then the only alternative to that death is recovery. There is no third option. And someone who says there's another way out of an addiction is leading you down a garden path. The truth is, this is the investment we need to make if we truly care about the dignity of those individuals. And if you want to see what that looks like, I invite everyone to come to a recovery conference tomorrow and see 2,000 people incredibly excited about the hope of what it means to live fulfilled in your community as a family member, as a brother and a mother again, because of recovery. And the contrast to that, the culture of life is a culture of death that Alberta is just saying no to.
Perfect. And did you have a follow-up there, Alana?
I do, yes.
Just on the data, Alana, I'll get Sam to be in touch with you on that. I'm assuming that we looked at the high water mark and then just saw where we were relative to the high water mark, but we do have a number of ways of looking at the data, so I'll get Sam to follow up with you on that.
Thank you, I appreciate that.
Yep.
And part of this is just a follow-up to the comments that were just made, and then I have my separate question. The follow-up to that is that you were saying that because there's safe supply programs happening in BC, that massively increases the supply of drugs into the unregulated drug market. Correct me if I'm wrong, but I'm pretty sure there's under 5,000 people who are being prescribed safe supply in BC. So I'm wondering if you can kind of clarify how you think that would have, a quote-unquote major impact here in Alberta. But my second question is actually about the My Recovery Plan. I mean, we've been hearing about this for, at least a year, but maybe longer. We were saying that this My Recovery Plan would come online. It would track wait lists, site capacities, outcomes for clients. Of course, we haven't seen that. At least it's not public. I'm just wondering if that data will be released publicly. I understand it's owned by a private company now. So where are we at with that? Are we going to see that data? And is there any suggestion to say if our wait lists have gone down at all at Alberta, or did we even have a baseline of where they were at? Just an update on My Recovery Plan and then the safe supply in BC, please.
Right. Well, look, I mean, I think some of the seizures that we're seeing with the RCMP and some of the reporting that Adam Zivo has done has demonstrated that there are a percentage of clients on safe supply who sell their drugs to a drug dealer so they can get fentanyl, and then those drugs become available into the illicit market. So that's what we're trying to get a handle on. It's the reason why we asked for a chemical tracer in the drugs to find out how many are coming into Alberta. And it's the reason why we met with BC to see if we could start tracking the amount of safe supply drugs that are collected when they do drug bust. So we're trying to get more information around that. But that's the worrying trend that we have seen, is that by just making prescriptions available, there is already evidence that it's getting into the illicit market. When it comes to the wait list, let me just get Dan. He said that he wanted to weigh in. Dr. Day will come in and talk a little bit about the data.
So I appreciate the opportunity to comment. There was an article published in the Journal of the American Medical Association Internal Medicine that just was published in March, so just last month, that was looking at prescribing patterns in British Columbia with the introduction of safe supply, which even though there's a relatively small number of people in British Columbia who are receiving safe supply, the actual total volume of pills being prescribed in British Columbia from all sources has more than doubled since safe supply was introduced. So you can talk about a small number of people, but we know that access to any addictive drug increases the risk of addiction in a population. We've known that since the 1990s with the introduction of OxyContin. And I mean, it's ironic that jurisdictions are suing the pharmaceutical companies for introducing policies that increase the supply of drugs to the population. We know from this Canadian data that was published last month that you can go and look up and look at the total numbers. We know that even though the relative number of people receiving those prescriptions is small, the fact of the matter is the actual volume of drug making it to the public is quite high.
I'll answer the question on data, but it's likely in the tune of tens of millions of pills are distributed unwitnessed, and to what proportion diverted, we don't know, in the safe supply in BC. Tens of millions of pills. Our office spoke to an American researcher who believes it might be that the product of safe supply in Canada has now increased supply of high-powered opioids greater to the degree that oxycodone did in the late 90s and early 2000s. So it is very devastating to see what can happen when you increase the supply to that degree. When it comes to the data in My Recovery Plan, the data is still held by AHS, of course, always has and will be. And My Recovery Plan, we partnered with a nonprofit third-party organization for the software who don't own any of the data. And what we're doing is there have been some delays in running it out, in part because we want to make sure we're following every single requirement we have when it comes to privacy protection. This privacy impact assessment and the work we need to do is very in-depth. We have the highest standards, and for good reason. We want to keep that in Alberta, no matter who touches the data. The fact is we need to understand across our healthcare system, and especially within what is the most complex problem, I'd say, from a policy perspective in our healthcare, is mental health and addiction and interfacing data from different bodies and different data sets. So we want to make sure we keep those high standards to get the data into the right hands of the right people at the right time with those highest possible standards. And that's what My Recovery Plan is going to do.
Thanks, Alana. And that's all the time we have for questions today. Thank you, everybody, for joining us.